We have a question from Rachel, and she's asking if you included reviews that were mixed methods and whether there were more issues or fewer fidelity issues with this.
I've got that information to hand, Jane, if I might reply to that.
Ahead.
So yes, we did, as Rachel's suspecting, find that mixed methods reviews had more fidelity concerns. It's difficult, of course, from a published report to pin down to why that might be the case. It might be the complexity of the evidence, but it also might be that people doing mixed methods might gravitate more to quantitative ways of doing things. So they may have been interpreting things in a more quantitative way, and perhaps may have been those who more specifically like to count things within categories, but also there's a real issue there about trying to apply only the GRADE CERQual, which is designed for qualitative, across both quantitative and qualitative, and we certainly haven't done any research on how to apply GRADE CERQual to quantitative findings within a mixed method. So they in some cases they were leaping ahead of the methodology there, yeah, so we do have data that shows it's perhaps more of a problem, both in the sort of implementing it and perhaps in the conceptualization, with people bringing in the sort of mixed method mindset as well.
Can I add to that, Andrew? So in Cochrane, we tend to have qualitative evidence syntheses that are often linked with quantitative intervention effect reviews on the same topic or intervention. And they are assessed differently. So GRADE profiles are added to the quantitative effects, and GRADE CERQual profiles are added to the qualitative evidence syntheses. Often in the qualitative evidence synthesis, there's a further round of synthesis to integrate the qualitative and the quantitative together in a matrix or using a logic model. And at the moment, we aren't applying a grading of recommendations to that integration stage. The GRADE CERQual group is interested in mixed method GRADE CERQual, but it is yet to be developed. What normally happens in a decision-making or guideline context is that the different sources of evidence from the different types of reviews are brought together in an evidence to decision profile, and the respective GRADE CERQual and GRADE assessments are then fed through into that evidence to decision framework, and sometimes that they can overlay. So things like values and preferences, there might be a little bit of information in both quantitative and qualitative on that. But you might have seen in the BMJ coming up, there is a new tool for looking at values. So there's lots of developments in this area at the moment. So keep posted. Next question, I think. Hope that answers your question. It was a great question, Rachel. Thank you.
Okay, so Samir is asking if these new tools, ICOS and Camelot, are also usable for quantitative data?
No, so this is just qualitative evidence synthesis that we're talking about, and we want the application of GRADE CERQual. Interestingly, we have seen GRADE CERQual, authors have tried applying it to quantitative effect reviews, but it's completely the wrong approach. It's methodologically incoherent, and you should be applying grading of recommendations to quantitative effect data, not GRADE CERQual.
Yeah, I was just wanting to add there that, you know, Samir, that the GRADE Pro is the original software for helping with grade. So in a sense, ICOS has come along to meet a different need. Your need that you're asking about is already met by GRADE Pro in terms of the software approach. And of course, the Cochrane risk of bias tools are the equivalent to our Camelot approach, or not equivalent in the sense of working in the same way, but in terms of what you're asking for there. So you're already catered for, but we're not covering that in our particular clinic here. And there's plenty of support in Cochrane for both GRADE Pro and for the Cochrane risk of bias tools.
Okay, next, Maria says, great presentation, thank you. Adequacy is somehow difficult for some authors. What free tools do you recommend for the assessment of adequacy?
Should I take that one to start with, Andrew? So great question, Maria. Thank you. Adequacy is a difficult component to get your head around. And we do say that you do need an experienced qualitative researcher on the team to get your head around some of these components. So adequacy is not just about the number of studies. It could be about the amount of data relevant in the studies that you've got that you consider in terms of adequacy. It's also about the richness of that data. Is it adequate? There's no gold standard as to what is an adequate amount of data. And studies do vary. I mean, you could have a huge study with 200 participants across 60 countries, you know, very unusual qualitative study that addresses, you know, an awful lot of issues and provides really rich data. In contrast, you could have a study that has 5 participants with very thin data. So it's not just the number of studies, it's actually the amount of data that's in those studies that's relevant to your question. So it sort of overlaps a little bit with relevance. You need to understand how relevant the data is that you can use as to whether the overall amount of data that you've got is adequate. And these are subjective review team assessments that you make as to what is adequate amount of data for answering the question. So it's not the number of studies, which a lot of people just sort of subscribe to. Are there any tools that you recommend for assessing adequacy? Well, I don't think there are any tools. It's about subjective judgments. It's about having some criteria in your mind for each specific review and which particular finding that you're looking at, and thinking about what's in your protocol. So your protocol becomes very important here. Your protocol outlines your question, your context of interest, the population, and, you know, all the sort of inclusion and exclusion criteria. You need an adequate amount of data to answer that question or sub-questions from it, or the subgroup analyses that you're doing. And these are team discussions. This is where reflexivity of the author team comes in, and also engagement with your stakeholders and your public representatives as to whether your data that you've got in your review is adequate to address your review finding. Andrew, I don't know whether you want to add to anything to that.
I mean, that's an excellent summary. I think what's really good about this is, first of all, getting across the point that although there is a tool specifically for richness, which you highlighted, that is only one of the subcomponents, if we could call them such, although we don't officially do that, for adequacy. And the other thing is that as a problem that we identified from the audit that Megan did, that people tended to focus, when it comes to the other bit, on either the number of studies or the participants. But in Jane's example, she very clearly said that actually both of those are of interest because they're not necessarily synonymous with the adequacy of the data. So we're building up a picture, if you like, of 4 things that we could start with when considering adequacy. We've got the number of studies, the number of participants, the richness of the data, and the thickness of the data. And as Jane said, the tool for the richness and thickness of the data is there. It's very hard to get beyond quantitative terms in terms of number of studies and number of participants. So recording those numbers may well be good enough. So there is some room for numbers in our group.
Great. Samir's asking if there are any tools for quantitative data, but I think this has already been answered. GRADE Pro is the tool. Ruth asks, have you looked at whether the judgments show consistency? For example, if different teams do them, do they arrive at the same competence assessments?
Did you want to take that one, Andrew?
Oh, thank you, Jane.
I can add.
Yeah, no, I was just sort of reflecting on that one of the things as a team I remember us discussing, I think it was probably at our sort of summit in Barcelona, is that actually GRADE CERQual isn't actually designed for cross review comparisons, that each review has its own needs, and therefore we wouldn't expect the judgments that are made across different reviews, and I know this is slightly different from the angle that the person's coming from, that Ruth's coming from, but we wouldn't expect that different reviews would necessarily interpret the thresholds in the same way. So we're not looking for a replicability in terms of whether teams apply things consistently. Aside from remarking that is sort of primarily a quantitative sort of led requirement, I think for me the issue is more about being transparent in their judgment, so that if teams do come up with something different, we can actually see where that difference lies. So I think we're not doing laboratory experiments where we expect people to come up with the same assessments, but we are expecting them to provide enough information so we can see reasons for what you would call inconsistencies, but we would call variation in interpretation.
Yeah, thanks, Ruth. That's a great question, and Andrew's provided a really neat answer to that. There are a couple of other features of qualitative evidence synthesis that might actually lead to variation. So you know, and Andrew's the expert in searching, but it is harder to search for qualitative studies. So different teams might find different studies. The other thing is that it's becoming increasingly common to sample from those studies that meet the eligibility criteria to actually come up with a manageable synthesis. So the actual sampling criteria might be slightly different across teams, and the studies that they choose to include might be slightly different. There's also a sort of a toing and froing, because you can potentially, with your adequacy, if you have you know, you don't you have, if you want to address some of the concerns about adequacy, you could go back to your sample and pull in more studies, for example, to increase adequacy. So you can go backwards and forth. A qualitative evidence synthesis is very iterative. It's very different than a quantitative intervention effect review, where you would start off aiming to include everything. A qualitative evidence synthesis often needs a sample to come up with a really rich depth synthesis, and that it really is about that sort of consensus approach to developing a qualitative evidence synthesis, and the protocol can be iteratively changed as you go along, as long as you make those changes transparent and the reasons and the decisions for them. So it is much more complex with the qualitative evidence synthesis, and as Andrew says, transparency is more important than reproducibility.
Okay, so one last final question from Jennifer. She's asking about the numbers of participants. Can we focus on data saturation?
Yeah, well, that's an interesting one, isn't it? I mean, you mean data saturation in the primary studies? I don't know whether you want to add, Jennifer, to clarify that, but in the primary, yes, yeah, in the primary studies, okay. So data saturation is often a marker of when the findings don't change. In the qualitative and implementation methods group, we tend to have a slightly different approach and talk about a tipping point of which adding one more study doesn't change the findings, and it would be the same that adding one more interview doesn't change your interpretation of findings. And a lot of the primary studies don't talk about data saturation. Good ones do, but actually a lot of them don't. So, and if they do talk about data saturation, they don't talk about the criteria of which they've made to make judgments about data saturation. So you can sometimes contact the primary review author, primary study authors, if you're unsure. The other thing to think about is that often your primary study doesn't match the exact question that you're actually looking at a review level. So only aspects of that primary study might be extracted and put forward into the qualitative evidence synthesis. So things like data saturation become less important if you're not using all of the data or just an aspect for it. Again, this is where an experienced qualitative review team is needed to make these decisions and to look at the quality of the primary qualitative study. So The assessment of methodological limitations in the primary study will help with this, will help you make some of these decisions. So yes, we do think about data saturation, but we do it in a sort of more abstract, global, holistic way than just a simple yes, no. Andrew, did you want to add to that?
Yeah, it was certainly making me reflect both what Jennifer's asking and your reply to that. I think this is really a nice illustration, Jennifer, of the importance of using all four components at the same time. And Jane indicated that with her example about that the review question isn't going to necessarily be the same as the study question in the primary studies. And therefore, you can imagine that, for example, that a study that is good in its coverage of target populations. So it's lots of different studies from different contexts. So therefore is rating high for relevance and maybe rating high for adequacy of data as well, might actually move you against data saturation, because you're getting lots of observations where the experience is quite different from each other. So if you've got, as with populations, if the studies are homogeneous, then you're more likely to reach a point where people are saying the same things over and over again. But if the studies are accessing the full range of populations covered by your review, then it's less likely that they will be saying the same thing, and more likely that they will be bringing something relevant to their different contexts. So I think the take-home point for the webinar as a whole really is that rather than focusing on these individual components in isolation, as we tend to do when we ask questions about them, that when we think of how they interact, it then sort of helps us to see that we couldn't, for example, just focus on data saturation to answer the adequacy problem without it having implications for such things as relevance.
Great. And one last question from Joseph. He says, this question may not be so relevant to this topic. Is the QES systematic review protocol mandatory to be registered a priori? Which registry is best recommended?
You're on mute, Jane.
Sorry, Joseph, I think that's a great question. And in Cochrane, we do actually need to register a protocol before you proceed to full review, the same as in Campbell. There is Prospero, where you can register qualitative evidence syntheses if there's a health interest or health outcome or phenomenon of interest. The importance of the protocol is great for in relation to GRADE CERQual, because you have to describe your methods of GRADE CERQual, and this we can pick up at the peer review stage to make sure that you've articulated the components in the right way and you've understood it and you're applying the approach in the right way. So having a protocol that adequately describes the application of GRADE CERQual is really important. It also then shows that the team, whether the team understands it. We often, when we get a Cochrane protocol in and we look at the team and they want to apply GRADE CERQual, which we highly recommend because that's what decision makers want, we then can signpost people to all the training resources and help them make sure that they apply it appropriately. So yeah, great question. Protocol is really important.